Okay, according to the Centers for Disease Control, more than 34 million people in the U.S. have diabetes. If you have diabetes and suffer from diabetic nerve pain, today's guest has some valuable information for you. His name is Dr. Matt Thomas from 360 Neuropathy in Frisco. He is board certified in neuropathy and joins us to share more. Good morning, Dr. Thomas. It's so nice to see you.
Hi, Jane. It's great to be back on Good Morning Texas. Thank you.
It's great to have you. Okay, for folks who aren't familiar with it, what is diabetic nerve pain, and is it the same condition as peripheral neuropathy?
Yes, diabetic nerve pain is essentially peripheral neuropathy. Around 50% of people who suffer with diabetes have peripheral neuropathy. Nerve cells are damaged or destroyed due to consistently high blood sugar. The peripheral nervous system are the nerves that come off the side of the spinal cord, controlling the arms and hands, legs and feet, as well as other tissues and visceral organs. Now, these damaged nerves have to communicate with the central nervous system, which is comprised of the brain and the spinal cord. Now, this process doesn't happen overnight. Numbness, tingling, electric shock-like pain, burning sensations, and muscle weakness in the extremities, this typically starts off slowly and gradually increases over time.
So, in your opinion, is it possible to reverse diabetic nerve pain or neuropathy?
Oh, it's absolutely possible to reverse peripheral neuropathy. But as with any nerve damage, it's very important to be evaluated properly and diagnosed. If someone reaches 85% sensory loss, it becomes very, very difficult to reverse the process and undo the damage that's been done. We've seen a lot of people who have come through our doors who have waited way too long, and many of these people end up confined to a walker or a wheelchair. At 360 Neuropathy, we have unique treatments that are designed to reestablish these pathways and undo the damage that's been done. And we do this at the cellular level, which helps decrease pain and increase range of motion and mobility.
Wow, we hard to see people suffer with things like that. So what kind of treatments, you mentioned a little bit about it, what kind of treatments do you use for diabetics suffering with that kind of pain?
So at 360 Neuropathy, we like to take a multi-pronged approach to neuropathy reversal. There are several things that need to happen. You have to stimulate the nerves to grow. And one of the reasons these nerves are dying is due to a lack of oxygen and nutrients going to the nerves, and you've got to reestablish that blood flow. So those are the two of the most important things. But there's a nutrition component as well. A big reason these nerves are dying is because the body's not getting what it needs nutritionally so that it can repair itself properly. And these are just a few of the things that we do here in our office. But let me be clear, this is a long-term permanent solution. Unlike gabapentin, Cymbalta, and Lyrica, which just mask and manage the symptoms, we look to get to the underlying cause of the problem.
So